Hello and welcome back to Patient Knowledge. I'm Dr. Kirmani, and today I'm going to be talking about a condition that affects the bowel. Yes, it's called as Irritable Bowel Syndrome. So let's get straight into it and find out more about this condition. In this video, I will run you through what's Irritable Bowel Syndrome, what are the causes, its symptoms, how common it is, what's the treatment, and at the end of the video I will give you a list of foods to avoid if you have irritable bowel syndrome. So stay till the end. Now, what's irritable bowel syndrome? And irritable bowel syndrome is also known as irritable colon or irritable digestive system. It's one that does not work smoothly and causes abdominal problems such as colicky pain and disturbed bowel actions. The bowel is a muscular tube that propels the food along the waves. It's called peristalsis. This muscular action may become overactive and cause spasms or tight contractions, rather like a cramp in the leg muscles. What are the causes? Infection of the bowel, food irritation, that is spicy food, food allergy with milk or cream, lack of bulk or fiber in the diet, overuse of laxatives, pain-killing drugs and antibiotics, smoking, salicylates or related chemicals such as aspirin, food colorings, and fresh pineapple are some of the possible causes or aggravating factors. Well, there is no clear-cut proven cause, but one theory is that an important factor is emotional stress, especially in those people who tend to bottle things up inside. However, there's no proof supporting this theory. Now let's look at some of the symptoms. This condition affects the bowel, so most of the symptoms are related to the digestive system. Now the main symptom is a vague discomfort or a cramp-like pain in the abdomen, in the center or left side of the abdomen. This pain is usually relieved by passing wind or by a bowel movement. Diarrhea or constipation may occur, and sometimes the motions will be like small, hard pellets. Mucus may also be passed from time to time. You may also feel mildly nauseated of your food, bloated or flatulent. There may also be a sensation of incomplete emptying of the bladder. Now, how common it is and any risks involved in this condition. So, at least one person in every 100 has it, and many simply learn to live with it. Some authorities believe that up to 30% of the population have it to some degree. It can develop at any age, but it usually begins in the late teens or early 20s. It's likely to affect twice as many women as men. Now you must be wondering if there are any risks involved in this condition. Well, the good news is it's harmless, but it's common for those who have it to worry that they have cancer. Now, it is usual to carry out investigations to ensure that there is no disease in the bowel. Well, the investigations can be to look at the bowel by passing a tube through the mouth and visualizing the entire gut, and also ruling out any infections of the bowel by doing a stool examination. Once the investigations are clear, the diagnosis is confirmed that this is irritable bowel syndrome and it does not have any organic cause. There's no cure and the problem may come and go for years. Now, what's the treatment? Self-help. Anyone with an irritable bowel should try to work out the things that make the symptoms worse. If you recognize stresses and strains in your life, try to develop a more relaxed lifestyle. You may have to be less of a perfectionist in your approach to life, and try to avoid any foods that you can identify as causing the problem. You may have to restrict or cut out smoking and alcohol. A high fiber diet may be the answer to your problem. This can be helped by adding 2 teaspoonfuls of unprocessed bran to your diet each day if increased fiber and fluids have not quite settled the problem. Now, medical help is available. If self help measures are not controlling the problem, your doctor will be able to give you medicine to settle the painful spasms of an irritable bowel. You should avoid taking any medicines not recommended by your doctor. Now, here's a list of foods that one needs to avoid if they have irritable bowel syndrome because they could be gas forming, they could be hard to digest, or may have some kind of substance that may aggravate the condition. Some of the foods are cauliflower, beans, lentils, garlic and onions, chocolate. Well, for the chocolate lovers, it's a bit disappointing because chocolate has caffeine and increased sugar content. But the good news is you can take vegan chocolates and they are better option. Foods with fructose. Well, apples, pears, and dried fruits has naturally occurring fructose, which can trigger irritable bowel syndrome. Bread and pasta and sugar-free chewing gum has got artificial sweeteners such as xylitol or sorbitol, and also avoid any packaged or fatty food. Now, this is a list that might be able to help you identify if any of these foods are causing you trouble. Try to avoid them so that you can have a good control over your symptoms. That's all for today. I hope this information about irritable bowel syndrome was useful in understanding what is the condition, what could be the trigger factors, and how to manage it. Thank you for listening. If you wish to hear more of such kind of health videos, support my channel by liking, sharing, and subscribing it. Bye for now.